no!
His struggles were only the beginning.
He's trying to cure cancer. Who wouldn't support that?
Harry Connick Jr. in a true story.
My daughter is dying. I'm hoping for a miracle. I can't lose her too.
One of the greatest medical discoveries of our time. I think I can save your life. Living Proof. A lifetime red carpet movie event. Premieres Saturday, October 18th.
The hero, Dr. Dennis Slamon, struggled, and sacrificed because he believed in something and he knew it would work. And the movie does tell the story, the true life story, not just of the doctor and his family and all the people, the scientists, but also the women and their families.
The film shows it fast growing.
Now, what was previously one of the worst breast cancers has become one of the better with regards to the clinical behavior, and we have increased the cure rates by a significant amount, perhaps as much as a third. We think it may be as much as a half as more data come in. That's one example. The Lee Translational Laboratory should be able to do that again and again with the subtypes that we'll be studying.
Herceptin, a multimodal approach targeting HER2-positive breast cancer. For some women, effective treatment of breast cancer can start deep at the root of the disease. Some of the most aggressive breast cancers are driven by a transmembrane receptor protein known as HER2, a member of the HER family of receptor tyrosine kinases. Roughly 20,000 HER2 receptors are typically expressed on the surface of healthy breast cells. In approximately 25% of primary breast cancers, the HER2 protein is overexpressed, resulting in tumor cells with as many as 2 million receptors present on the surface of each cell. These cancers are called HER2 positive. The effect of HER2 overexpression is a tremendous increase in receptor-mediated intracellular signaling, directing the cell to proliferate uncontrollably. For this reason, HER2-driven disease results in an aggressive form of breast cancer, which, if left untreated, can progress rapidly. Herceptin is a monoclonal antibody specifically designed to target the HER2 receptor. With an extended half-life that allows for constant exposure to tumor cells, based on preclinical studies.
There are some parallels for being here with Lee Genes. You guys are certainly aware of the fact that in this venue, one size doesn't fit all. The same is true in the therapy for the major cancers. So the premise that really has changed the paradigm of cancer treatment is that the disease itself, cancer, is not a single disease. That even within a given organ, it's not a single disease. That the only thing all breast cancers share in common is the organ in which they originate, but that it turns out there are different subtypes. And that we need to develop new therapeutic approaches based on this information. And so it's this kind of research in terms of dissecting the disease apart that I think really will make us change how we approach the disease. There are some things that are already occurring that are encouraging in the sense that the death rate from the disease is now on a downturn. The incidence of the disease appears to be, at this point, relatively stable. There's about 200,000 new cases, as you've already heard, a year. What we hope is that some of the research that will come out of the LEAD program will affect women all over the world once we begin to understand how we can better approach some of these subtypes.